Listen, this area of the country, as you know, was hit so hard by COVID early on in the spring and then seemed to really get it under control. Now we're really in the throes of this second wave. What is it that you can tell people who are suffering from COVID fatigue now, particularly in this region?
Well, I can certainly empathize with them. All of us have been suffering from this. It's been going on now for almost 11 months. So it's totally understandable that people have COVID fatigue. But my message to them is we are now in a very precarious situation. If you look at the slope of infections in the United States as a whole, it's really terrible. I mean, you're having over 200,000, close to 300,000 cases per day, between 2,000 and 3,000 deaths. There are over 100,000 hospitalizations. And as of yesterday, almost 290,000 deaths have occurred in the country. You got to look at the data and you got to hit it square between the eyes. It's real. It's not fake. So we've got to take it seriously, even though we have COVID fatigue. Over the next month or so, we've got to double down, making sure we do the things that we're talking about all the time: universal wearing of masks, keeping distance, avoiding crowds in congregate settings. We know it's difficult, but help is on the way. Soon we will have a vaccine. So if we can just hang in there a bit longer, do those public health measures, we're going to get through this and we're going to get out of it. But we can't give up to COVID fatigue now. That would be disastrous if we did that.